At first, it looked like a simple, stiff neck, something countless children experience, easily blamed on sleep position or a mild strain. But what no one knew yet, not her parents, not her local doctors, not even the girl herself, was that her body had begun a process so rare, so cruel, and so irreversible that it would eventually trap her in her own skeleton. By the time she turned 15, she could no longer open her mouth to speak. Her arms refused to bend, and worst of all, she was still completely conscious, aware of every horrifying step in her transformation. This is the true case of a young girl from India suffering from fibrodysplasia ossificans progressiva, FOP, a genetic disease so rare that fewer than 800 cases have ever been confirmed worldwide. But rarity offers no mercy. And for this girl, the diagnosis was the beginning of a real-life nightmare, one where her muscles, tendons, and ligaments began to slowly turn to bone, where her own body started growing a second skeleton. She was just 12 when it began. Her family lived in a rural town, and they initially brushed off her complaints. Her neck was sore, her back hurt after playing. But she wasn't sick. There was no fever, no visible injury. Still, the pain didn't go away. Then came the swelling. Strange, hard bumps formed beneath her skin, first along her spine, then near her shoulders. When she tried to stretch or twist, she winced in pain. Her range of motion narrowed. Her parents took her to local doctors who believed it was a soft tissue infection, or perhaps early onset arthritis. They prescribed anti-inflammatories. Nothing worked. As the weeks passed, her joints began to lock. First the neck, then the elbows. Her arms couldn't bend. She had to be fed. Dressing herself became impossible. When scans were finally done, the doctors were stunned. Her muscles were calcifying, literally turning to bone. Ligaments and connective tissue were thickening with rogue calcium deposits. Biopsies ruled out tumors or bone cancer. What they discovered was something far more sinister. Her diagnosis came with a wave of disbelief. Fibrodysplasia ossificans progressiva, also known as Stone Man syndrome. Her body's repair system had turned against her. Whenever her tissue became inflamed, even from something as small as a fall or an injection, it triggered catastrophic bone growth in places where no bone should ever exist. FOP isn't just rare, it's terrifying. It begins subtly with limited motion or small lumps, but it never stops. Every injury, every bruise, every inflammation can accelerate the disease. The immune system mistakes damage for a signal to heal and begins to replace muscle with bone. Her body, confused and relentless, was building a prison inside her flesh. And the worst part? Surgery only made it worse. Attempts to remove the bone or even perform basic dental work could lead to explosive growth. Scars became bridges for new ossification. Her own recovery process was lethal. By 13, her body was noticeably deformed. Her shoulders pulled forward, her elbows permanently stuck. Her neck stiffened until she could no longer turn her head. Her back arched unnaturally, fused by bone she never grew up with. Sitting became painful. Sleeping was dangerous. Pressure on the wrong part of her body could ignite another flare-up. Her family learned to never let her bump into anything. They patted her bed. They carried her like fragile glass. But no matter how carefully they tried to protect her body continued its betrayal. The girl could no longer attend school. Not just because of her physical limitations, but because she had become a medical curiosity. Her peers didn't understand. Some whispered rumors, others stared. She remained mentally sharp, brilliant even, but her body was locking her inside itself. She couldn't lift her hand to wave. She couldn't run or play. Her world became smaller every day. Her family described watching her slowly vanish into her own skeleton, knowing she was still in there, still dreaming, still understanding everything around her, yet trapped and helpless to stop it. By 15, the disease reached its most devastating stage. Her jaw fused. She could no longer open her mouth more than a few millimeters. Solid food was out of the question. Speech became a whisper. Her ribs had begun to ossify, limiting her breathing. With each year, her lung capacity shrank. Oxygen became harder to pull in. Doctors warned that the disease almost always ends in respiratory failure, when the rib cage becomes too rigid to expand. The slow suffocation of a fully aware person. A body turned into a tomb. And yet, despite everything, she remained incredibly strong. Her case was submitted to the New England Journal of Medicine in 2023 to raise awareness of FOP. The article described the extent of her condition with clinical precision. Overgrowth of bone in nearly every major joint, complete ossification of the jaw, limited thoracic expansion, and progressive deformity. But what the article couldn't convey, what no photograph or chart could express, was the quiet terror of her experience. Her mind, untouched by the disease, was still trapped in that body, fully present, fully aware, watching, waiting, enduring. Doctors explain that FOP has no cure. There's no medication that can stop the ossification. Only a few experimental drugs exist, and even those offer modest results. The disease is genetic, irreversible, and relentlessly progressive. In most cases, patients are wheelchair-bound by their 20s and don't survive beyond their 40s. Even small acts like coughing, sneezing, or stretching can trigger flares. A single injection or surgical incision can trigger an avalanche of bone growth. One patient was left fully paralyzed after routine dental work. The condition is so sensitive that even vaccines must be administered with extreme care or avoided altogether. What makes FOP so horrifying is not just the physical suffering, but the psychological dimension. The feeling of being slowly frozen inside your own body, of knowing what's coming, of watching your future slip away, one joint at a time. You can't run from it. You can't stop it. You can only wait and try not to fall. Try not to bump into anything. Try not to need surgery. Try not to make a mistake that could cost you what little freedom you have left. Every moment becomes a balancing act between caution and hope. And all the while, your body continues building the bones that will eventually seal you inside. To this day, her condition remains unchanged, her second skeleton still growing. There is no Hollywood ending, no miracle cure, no last-minute surgery to set her free. She lives in a fragile balance between movement and stasis, between breath and bone. For the world, she is one of only a few hundred known cases. For her family, she is everything, and for herself, she is a ghost trapped in the flesh, a mind untouched inside a body slowly turning to stone. So if you've never heard of fibrodysplasia ossificans progressiva before, now you know. You know the name. You know the consequences. You know that it exists. And you know that there are people, real people, still living with it right now. Waiting, hoping, enduring. Because sometimes the most terrifying monsters don't come from outside the body. They grow within.